The nurse is assessing a client with right-sided heart failure. Which findings are expected? Select all that apply. A. Peripheral edema. B. Jugular vein distension. C. Hepatomegaly. D. Pulmonary congestion. E. Ascites. Options A, B, C, and E are correct answers. Rationale: right-sided heart failure leads to systemic congestion, causing edema, JVD, hepatomegaly, and ascites. Pulmonary congestion is seen in left-sided heart failure. The nurse is educating a client with atrial fibrillation about stroke prevention. Which interventions are appropriate? Select all that apply. A. Taking prescribed anticoagulants. B. Monitoring for signs of bleeding. C. Avoiding all physical activity. D. Controlling hypertension. E. Reducing caffeine intake. Options A, B, D, and E are correct answers. Rationale: clients with AFib should take anticoagulants, monitor for bleeding, manage hypertension, and reduce stimulants like caffeine. Exercise is not contraindicated. The nurse is caring for a client with a suspected myocardial infarction, MI. Which symptoms require immediate intervention? Select all that apply. A. Chest pain unrelieved by rest. B. Diaphoresis. C. Shortness of breath. D. Sharp pain that worsens with deep breathing. E. Nausea and vomiting. Options A, B, C, and E are correct answers. Rationale: classic MI symptoms include unrelieved chest pain, diaphoresis, SOB, and nausea. Pleuritic pain, D, is more characteristic of pericarditis. The nurse is teaching a client about dietary modifications for hypertension. Which foods should the client avoid? Select all that apply. A. Canned soups. B. Processed meats. C. Fast food. D. Fresh vegetables. E. Pickles. Options A, B, C, and E are correct answers. Rationale: high-sodium foods, processed meats, canned foods, fast food, and pickles should be avoided. Fresh vegetables are encouraged. The nurse is preparing to administer digoxin. Which assessments are required before giving the medication? Select all that apply. A. Apical pulse for 1 full minute. B. Serum potassium level. C. Blood glucose level. D. Signs of digoxin toxicity, e.g. nausea, vision changes. E. Respiratory rate. Options A, B, and D are correct answers. Rationale: digoxin requires checking the apical pulse and potassium level. Signs of toxicity, nausea, vision changes should be monitored. Blood glucose and respiratory rate are not directly relevant. The nurse is teaching a client about lifestyle changes to lower cholesterol. Which recommendations are appropriate? Select all that apply. A. Increase fiber intake. B. Exercise regularly. C. Consume more red meat. D. Reduce saturated fats. E. Maintain a healthy weight. Options A, B, D, and E are correct answers. Rationale: high fiber, exercise, and reduced saturated fats help lower cholesterol. Red meat increases LDL cholesterol. The nurse is caring for a client receiving IV nitroglycerin for acute coronary syndrome. What precautions should the nurse take? Select all that apply. A. Monitor blood pressure closely. B. Assess for headache. C. Use non-PVC tubing. D. Administer through a central line only. E. Monitor for signs of hypotension. Options A, B, C, and E are correct answers. Rationale: nitroglycerin can cause hypotension and headaches. It should be given through non-PVC tubing. A central line is not required. The nurse is assessing a client for early signs of shock. Which findings are expected? Select all that apply. A. Tachycardia. B. Restlessness. C. Cool, clammy skin. D. Decreased urine output. E. Hypertension. Options A, B, C, and D are correct answers. Rationale: early shock presents with tachycardia, restlessness, cool skin, and low urine output. Hypotension occurs later. The nurse is caring for a client with infective endocarditis. Which complications should be monitored? Select all that apply. A. Stroke. B. Heart failure. C. Septic emboli. D. Liver failure. E. Valvular damage. Options A, B, C, and E are correct answers. Rationale: endocarditis can cause emboli, stroke, heart failure, and valve damage. Liver failure is not a common complication. A client with peripheral artery disease reports leg pain at rest. What should the nurse include in teaching? Select all that apply. A. Avoid crossing legs. B. Dangle legs when sitting. C. Stop smoking. D. Elevate legs above heart level. E. Walk regularly for exercise. Options A, B, C, and E are correct answers. Rationale: peripheral artery disease requires avoiding leg crossing, dangling legs for circulation, smoking cessation, and regular exercise. Leg elevation worsens symptoms.